Spect, S-P-E-C-T, it's an acronym, and it is single positron emission computed tomography, or CT scan. So it's a type of CT scan, and what happens is they inject a radionucleotide tracer, radioactive tracer into your body, which then goes and follows your blood vessels and kind of looks at blood flow in various tissues. So if you look at concussion studies specifically in patients with persistent concussion symptoms, we've found changes in SPECT up to 5.5 years after concussion. So potentially blood perfusion in the brain problems 5.5 years after the concussion has actually taken place. All right, so sounds very promising. Again, let's get into the problems. Similar cerebral perfusion findings have been found in patients with low back pain, patients with neck pain, patients with whiplash, patients with upper thoracic or upper back pain, patients with depression, patients with chronic fatigue, and a whole bunch of other things, right? So just because we find these findings on a SPECT scan and we say, oh, there's decreased cerebral perfusion, it must be due to their concussion. Not necessarily. It could be due to the fact that they may be depressed. They may have pain elsewhere in their body. They may have had, neck injury. We don't know, right? So all sorts of things can lead to decreased perfusion in the brain. So again, not really sure. Compared to normal, we see a difference. Compared to other conditions, we may not necessarily see a difference. So what are we really looking at? We don't know.